Welcome back to PLAB Talks, the podcast that breaks down key clinical topics, one episode at a time. This is episode 2, and we're continuing our focused series on headache.
Okay, let's pivot now. A different kind of headache, one where psychosocial factors often play a really big part.
Ah, yes. Common scenario.
Here back in the GP surgery, Joanna Taylor, a 60-year-old lady, comes in. Bilateral headache, she says, for about 2 months now.
Bilateral 2 months, okay.
She works in a bank, recently got promoted, but describes a difficult boss. Issues at home with her husband and son, lots going on.
Stressors identified.
And she asks, "What is wrong with me, doctor? Do you think it is a stroke? Can I have a CT scan?" How do you approach her concerns? And what's your provisional diagnosis?
Right. This case immediately flags how much psychosocial factors can influence headache presentation. It's quite striking sometimes. The description bilateral headache, background of significant life stress, it strongly suggests a tension headache.
Okay, tension type.
Exactly. Regarding her concern about a stroke, that's understandable, patients worry. Your role here is clear reassurance. Explain calmly that typical stroke symptoms, slurred speech, one-sided weakness, they're just not there in her story.
Right. Address the fear directly.
Absolutely. And crucially, clarify about the CT scan. Explain it's unlikely to be needed because her symptoms don't align with a stroke picture, and importantly, it would expose her to unnecessary radiation.
So how do you explain a tension headache to Joanna in a way she'll understand? And what's the main management approach?
You'd explain that a tension headache is a very common type of headache. Often feels like a constant ache or pressure, usually on both sides of the head.
Like a band?
Yeah, patients often describe it like a tight band around the head. And you gently explain it's very typically strongly associated with stress or muscle tension in the neck and scalp. The critical insight for management here is that it's primarily about stress relief, rather than just reaching for pills straight away.
Right. Lifestyle first.
Lifestyle first. Suggest practical strategies, relaxation techniques, regular exercise, maybe massage, or activities like yoga or Tai Chi, things she might enjoy.
And for the acute headache itself?
For the acute episodes, yes, paracetamol or ibuprofen can be taken. But it's really important to advise trying relaxation or even just getting some proper sleep first. Often, that's enough.
Good advice.
And a vital warning. Caution against taking too much medication. Overusing painkillers can paradoxically cause medication overuse headaches. Trap to avoid.
It's so clear how much stress is a factor here. For those deeper underlying stressors, you mentioned the boss, the family stuff. What kind of support might you recommend?
Yeah, this is where holistic care really comes into its own, isn't it?
Absolutely.
We definitely suggest considering counseling sessions. They can be invaluable in helping her address the root causes of the stress she's under, giving her coping strategies.
Practical support.
Exactly. And, as always, robust safety netting advice is essential. Counsel her to return if the headache pattern changes, if it becomes progressive, or sudden and severe, or if headaches become worse in the morning, or she develops any accompanying symptoms like fever, neck stiffness, or photophobia.
Right, the standard red flag.
Those are the signs that would absolutely warrant immediate reevaluation.
Thanks for tuning in to PLAB Talks. We'd love to hear your feedback, and we'll be continuing the headache series in the next episode. Stay curious, and see you soon.